us a thumbs up. Are we ready to go? Awesome. Okay, so welcome, friends. It's such an honor to be hosting all of y'all this evening. I want to start by thanking Maya and Victoria for agreeing to do an event with our cooperative. We've been big fans of both of their work for a long time, and when we heard that they were going to be doing a team-up book, we knew it was going to be something really special. So I also want to appreciate all the many people who are supporting the event tonight. We've kind of organized this in collaboration with the New Press, and especially Jay and Emily, who are here with us tonight and have been making a lot happen behind the scenes. We've also got captioning and ASL interpretation, which is a first for our cooperative and is really awesome. Thank you so much to Rodney, Nora, and Mike, who are here providing that. So the event tonight is being organized by Firestorm Books and Coffee. We're a 12-year-old anarchist bookstore in Asheville, North Carolina. Prior to the pandemic, we hosted hundreds of events every year at our cooperative, but currently we're closed to the public, and we're trying to figure out how to creatively continue to produce grassroots content like this event tonight online. Our entire catalog is online, and we ship books anywhere in the United States for just $1 if they're in stock. I hope that if you haven't already picked up copies of the panelists' books, that you'll consider doing so at the end of the night. So I don't think it's an overstatement to say that Prison by Any Other Name is one of the most important books published this year. In this moment when uprisings have pushed abolitionism into mainstream discourse, the book offers a critical corrective to popular misunderstandings of abolition that suggests we can achieve our goals simply by shifting the repressive power of the state from police officers to social workers or other friendlier agents. This is not the case, and Victoria and Maya, with the help of numerous contributors who have generously shared their stories, expose the danger in this framing of policing and confinement as uniquely embodied by billy clubs and police prison walls. So I want to go ahead and introduce our panelists this evening. Maya Shenwar, co-author of Prison by Any Other Name, is the editor-in-chief of Truth Out. In addition to this work, she's the author of Lockdown, Locked Out, and co-editor of the anthology Who Do You Serve, Who Do You Protect? And Maya lives in Chicago. Thanks so much for being here, Maya. Victoria Law, Maya's co-author, is a freelance journalist and author of Resistance Behind Bars and co-editor of Don't Leave Your Friends Behind. She's a co-founder of New York City Books Through Bars and lives in New York. Thank you so much, Victoria. We also have Stacy Thompson, so graduate of the Reconnect Leadership Program in the Coalition for Women Prisoners. She became the coordinator for the Coalition for Women Prisoners at the Correctional Association of New York, a nonprofit monitoring organization. She's trained other formerly incarcerated women to become advocates and has successfully advocated for the repeal of the Rockefeller drug laws, as well as laws prohibiting the shackling of pregnant people from giving birth while in custody and the Domestic Violence Survivors Justice Act. Joining these fantastic panelists, we have several folks from local Asheville-based organizations who work in areas that felt particularly relevant to the content of this book. We've got two folks from the Steady Collective, which is a non-judgmental harm reduction-based organization that serves people who use drugs here in Asheville. Since 2016, Firestorm has been able to host one of Steady's syringe access events. And just last year, Steady participants reported the performance of over 250 overdose reversals in our community, 250 lives saved. Tonight, we're joined by the Steady Collective's co-directors, Hill and Vanessa. Thank you so much for being here, Hill and Vanessa. And then lastly, big roster here from Blue Ridge Anarchist Black Cross, which is an abolitionist collective that believes incarceration increases social harm. Blue Ridge Anarchist Black Cross is part of an international network offering support to political prisoners And tonight we're joined by Julie Schenwar, one of Blue Ridge Anarchist Black Cross's founding members. Julie also helps to organize the local Asheville Prison Books program. So I think that y'all are really in for a treat tonight. We're gonna have a great conversation. If you want to submit questions, we're definitely gonna keep an eye on that and answer as many of them as we can. But we're gonna start right off with Victoria and Maya, who are gonna share a little bit, as well as Stacy, who are gonna share a little bit about the book, some of its contents, and then we will move into some questions. It's possible, as I understand it, that Stacy will have to leave a bit earlier than the other participants. So if you are watching this tonight and you have any questions for Stacy, please be sure to go ahead and submit those to us early so that we can make sure that those are answered before Stacy signs off. Thanks so much, and I'm gonna pass it off.
Thank you, Liberty, and thanks so much for inviting us to do this event. Both Vicky and I really loved doing events at Firestorm in person in the past, and it's really exciting to be back, even though we're in virtual form. So we came to work on this book several years ago because we saw a trend happening. And on the surface, it was a really exciting trend. We saw more and more people were getting interested in confronting the violence of incarceration and the violence of policing. And now, as the book is being released, we're in, I think, one of those powerful moments again with the resurgence of the Black Lives Matter movement. And we're at a point that even mainstream politicians have been forced by movements to acknowledge the existence of racist police perpetrated violence. So that's significant. But much of what mainstream Democrats and Republicans are proposing to deal with these things are surface level reforms to policing and prisons. So our book is about the many different ways that reforms simply offer prison alternatives that are replacements for prison. They don't shrink the system. They don't confront white supremacy or colonialism or capitalism or any of the system's oppressive roots. So these are alternatives like electronic monitoring devices, probation, confinement-based drug treatment centers and drug court more generally, sex worker rescue programs, psychiatric institutions. And these practices are about confinement and isolation and control. And so in these senses, they have a lot in common with prisons. And these so-called alternatives often expand surveillance and expand policing and hurt larger and larger numbers of people, and particularly Black and brown people, disabled people, deaf people, trans people, sex workers, and drug users. So we need to recognize that prisons are not just brick and mortar buildings. Police are not just the people with guns and badges that we see patrolling the streets. Social workers do policing. Teachers do policing. Doctors and nurses do policing. And we talk about in our community policing chapter that many of us who are just residents of neighborhoods do policing, even when we don't know that we're doing it. So imprisonment and policing are embedded in our larger society. And if we don't break out of this cycle and this system and expand our imaginations, then when we think about prison alternatives, we're saying, we can't put people in a cage called prison, so we have to find another cage to put them in. So here's one quick example. Recently, there's been a major expansion of electronic monitoring, and we've seen that expand even further during COVID. So this basically means home imprisonment, putting an electronic shackle on someone's ankle, and forcing them to stay at home aside from pre-approved departures. So this is very different from shelter in place or staying at home for actual health safety reasons. In 2005, there were 53,000 people on monitors in this country, and recent estimates have put it around 200,000 or more. And people on monitoring need to get that pre-approved permission to leave the house. And often it's just not granted. So people might be faced with an inability to get emergency medical care and visit their friends and family, go grocery shopping. One person that we interviewed said she couldn't even take the garbage out, which was right at the end of her housing complex. And of course, many people prefer electronic monitoring to prison because you're at home, you're not in a physical prison, but that doesn't mean it's not oppressive. So we have to get out of this mindset of it's either prison or prison light. Electronic monitoring is still a form of a cage. It's still built on white supremacy, and the people targeted for electronic monitoring are still marginalized people and still primarily Black and Indigenous people, people of color, disabled people, trans people, drug users. So plus, I think the other thing we have to keep in mind about this alternative and many of the different alternatives that we'll be discussing tonight, incarceration is often the penalty for violating the conditions of monitoring. So if you take that garbage out or go to the grocery store or, even seek medical care without pre-approved permission, you could be heading to prison. So this is a possibility that's always there. And one more thing we have to keep in mind, and this is true of electronic monitoring and pretty much every reform we discuss in our book, electronic monitoring is widening the net of surveillance and punishment. So that means that often people are placed on monitoring who would not otherwise be under any physical control of the state. They are charged with small time offenses that wouldn't ordinarily be resulting in a jail or prison sentence. So this is an expansion. And the same goes for probation and sex worker rescue programs and some psychiatric treatment and drug court, certainly, which we'll discuss a lot more later. So we have to keep in mind that many of these reforms were offered up under the mantle of helping people. So many of the things I just mentioned sound good. They sound like, oh, helping people when you first hear them. And wider society tends to accept them in good faith. But one of the things that we want to do is we want to ask why our choices need to be a bad cage or a little less bad cage. We need to expand our imaginations beyond forms of state violence and ask, what else could there be? So I'm going to turn it over to Vicki to talk about some of the ways that coercive treatment plays out as state violence.
Thanks so much, Maya, and thanks so much, Stacy, for joining us, and thanks so much, Rodney, for all of your amazing work doing interpretation. Tell me if I speak too fast. So one of the ways in which we're seeing diversions and alternatives play out in expanding ways in which people are placed under surveillance and coercive control is through sex worker rescue and diversion programs. We talk about this in our book. We interview a Black trans woman in Phoenix, Arizona, who at the time was a social work student at the Arizona State University named Monica Jones. Monica was walking down the street one Friday night. She was going to the bar that was maybe a half-hour walk away. A man pulled up, offered to give her a ride. She said, sure, got in his car. They started talking. He invited her to have a drink with him, and she said, yeah, that sounds great. Then he started asking her how much she wanted, and she realized that it was a sex work sting. Monica Jones did not leave her house intending to do sex work or be arrested or anything else, but because she was a Black trans woman, she was profiled as a sex worker, and she was picked up under a sex worker rescue program called Project Rose, which was ironically started by the Arizona State University School of Social Work, which is what she was enrolled in. And under Project Rose, social workers partnered with police officers, and once a month, they rode around together and they looked around on the streets and they picked up anybody that they thought was doing sex work. Keep in mind that people who are trans, people who are women of color, are often targeted as sex workers, even when they're just trying to go about their days. Then, instead of being arrested and taken to the precinct under Project Rose, women who were picked up were dragged to a church. And they were told then that they could either participate in this program that Project Rose had, which was a sex worker, quote unquote, rescue program, or they could be taken to the precinct and they would be charged with prostitution. And if they were convicted, they would serve time first in jail, or if it was a third or fourth conviction, actually be charged with a felony and face prison time. So as you can imagine, many people just chose, even though they didn't have a lawyer and they had not formally been charged by then, to just take their chances with this quote unquote alternative to incarceration, which for many, including Monica Jones, became a funnel to jail when they failed to finish the program. This program, contrary to its name, did not provide any resources such as job training or jobs or anything else that people might need to survive and thrive. Instead, participants were forced to attend programs during the work day, during the work week, with the threat of going to jail or being charged and then going to jail if they did not comply and go to all of these programs. Monica Jones kicked up a big stink, organized against Project Rose, and eventually succeeded, with the help of many advocates and sex worker rights organizations and other folks, in closing this down. But keep in mind that when we interviewed Monica in 2016, there were at least 61 other sex worker rescue programs that existed in more than 20 other states. And again, these are programs that are quote unquote rescuing people who are going about their business, not necessarily being, and are not offering any actual alternatives, and instead are threatening them with punishment. I want to bring attention to another sting that happened closer to home in New York City. Last year in June 2019, just as folks were gearing up for Pride, a young woman named Layleen Polanco, who is an Afro-Latinx trans woman, was arrested. She had previously been targeted in a New York Police Department sting operation against sex workers and was sent to anti-trafficking court. She was supposed to go to the court every month. She was supposed to participate in different programs related to sex work, and she missed several court dates, so an arrest warrant was issued. She was arrested in June 2019. A judge set a $500 bail, which she could not afford, and she was sent to Rikers Island. There, she got into an altercation with another woman, was placed in solitary confinement, and she died behind bars. And I bring this up because had there not been a program that actually targeted sex workers to drag them to this human trafficking intervention court and force them to go through a program that many did not want or need, with the penalty of being sent to jail for violating this program, Layleen Polanco might very well still be alive. Because had she suffered an epileptic seizure or anything else while she was at home or with friends or among other people, somebody might have called 911 earlier and had her brought to the hospital and given medical care. So we can see that these programs, far from doing anything that meet people's needs, actually are a pathway to jail and in some cases a pathway to death. Another way that we see the creep of criminalization come in is when we talk about mental health treatment. Now, keep in mind that sometimes people need help. You go to the hospital, they go to the doctor, and they seek support because they're feeling depressed or angry or hostile or suicidal or belligerent or something. And instead of getting help, they end up locked up in psychiatric confinement for either a short period of time or a long period of time. Sometimes people don't want help, but they're mandated by the courts or by their doctor to psychiatric confinement. And there are many similarities to jail and prison with psychiatric confinement. When you are placed in mandatory mental health confinement, you lose your bodily autonomy. You are not allowed to just get up from bed when you feel like getting up from bed. You are not allowed to sleep when you want to sleep. You are told when you can eat, when you can sleep, what programs you need to go to, and also what you can put in your body. So if you do not want to take medications, you will be forced to do so. If you can be physically punished for violating rules. One person we interviewed whose first experience of involuntary hospitalization when he was 12 for attempting suicide was placed in involuntary psychiatric confinement. And whenever he was seen to be acting out, which remember, he was 12 years old, he had just attempted suicide, might be crying, might be refusing to take medications, might be showing some sort of emotion, he was physically punished. And what that looked like was adult male guards wrapping him in a giant mat and then sitting on him until he stopped moving. Now, think of being 12 years old at the point of feeling like you want to end your life and having that be your treatment. At other times, he was placed in solitary confinement, a room where the door did not open from the inside all by himself for many, many hours. And rather than being placed, that these places being places that you receive support and help, psychiatric confinement often punishes people instead and deters people from seeking help and often re-traumatizes them. So we bring this up because there are many people in jails and prisons who are diagnosed with mental illnesses. And one of the solutions to the uptick in the numbers of people with mental health issues and illnesses in jails and prisons is to send them to psychiatric confinement instead. And what we're saying is we need to examine these types of psychiatric confinement as another type of prison. This does not mean that people should not be able to get help. They should not be able to seek medical help or mental health support. They should be able to seek medications if that is what they need and what they choose. They should be able to seek therapy. What they should not be forced to go through is something that looks remarkably like a prison and to be punished for asking for help. So we bring this up again because this is a similarity that we see to prison that is proposed as an alternative to prison. And we see this creep of criminalization climbing into all of these institutions that are supposedly helpful, but instead turn out not to be so helpful. With that, I'm going to turn it over to Stacy to talk about drug treatment centers and some of the pitfalls and helpful things she has found there.
First and foremost, I would like to thank my higher power because without God, I don't think I would actually be here today. And I would like to thank you, Vicki, for allowing me the platform to talk about this further and to share my experience with alternatives to incarceration programs. So in order to share that, I need to tell you how I got arrested, which was entrapment. And if I knew today what I knew, but I didn't know back then, I would probably have been able to advocate for myself. I was going to meet my mother at the train station one day, and I had not thought about getting high at that time. An undercover cop followed me like 2 blocks, and he kept asking me, where you get it from? And I just kept pointing in directions of dealers. Get it from them. They won't give it to me. They don't know me. And anyway, just to get rid of him, because I didn't want my mother to see him.
Can
Yeah.
I pause you for a second? It's really like you're breaking up,
Yeah.
so it's difficult to hear you.
Okay. Is this better?
Yes.
Is it
Start
better?
with
Is it?
your first sentence again.
Okay. To talk about my experiences of autism.
No, you're still breaking up. All right.
And how this.
Oh,
I
again.
turn my volume up.
Hmm.
And my volume is up more. Is that better?
No. The tech person says to maybe, you see at the bottom, there should be a leave. Can you leave the meeting and rejoin and see if that makes your connection better? Because yours is a really important story. And I definitely don't want it to be like all garbled when people hear.
Okay, I see more, but disconnect.
Disconnect and then just rejoin.
Is that better? Is
Say-
that better, Vicky?
You're still kind of a little.
Still can't hear me?
Hmm?
Can you still hear me? Can you hear me better now?
There's a little bit of a lag. Okay, so Jay said he just resent you the panelist link. So he said to disconnect from this Zoom and then click the link from that email and see if we can get you on a connection where everybody can hear you clearly.
Thanks, Victoria, for helping to walk through that. I'm wondering if while Stacy's reconnecting, oh, it looks like it's happening very quickly. Okay, great. I was going to suggest a next step, but let's check back in with Stacy.
And I'm coming.
We can hear you.
All right. Can you?
Your audio is great. We can't see you, but we can hear you.
I'm so sorry. Hold on. Let me
But your audio is great. So.
Okay. Well, how about I do it? Because I'd rather have audio than to have vision.
Okay, go for it.
Hey, wait a minute. Let me start.
Oh, and we can see you now too.
All right. Now we're on the move. Okay. There we are. And you can still hear me good?
Actually,
Yes.
I think, oh, go ahead.
No. Can you still hear me good? If not, I'm going to go off video and just talk.
No, go off video and just have your audio on. I guess maybe that's too
All
much
right.
for the internet there. Okay.
Yeah. All right. I'm gone. Can you still hear me better now?
Yes.
All right. I am so sorry for that. So I'm going to finish by telling you a bit about the experiences that I had with alternatives to incarceration. As I was saying, it was entrapment. An undercover police officer followed me until I needed to get rid of him because I didn't want my mother to see anybody with me because she sort of knew what I was doing. And I actually ended up getting it for him, and for that I was arrested. It was a misdemeanor, but I got charged with 3 to 4 years, or the alternative to incarceration program, which was drug treatment for 18 months. So the first drug treatment that I decided to do was Sunlight Center. Now, Sunlight Center was an ideal rehab for me, but their motto was breaking you down to rebuild you, and possibly stronger than before, supposedly. And which I pretty much understand now, but back then I just didn't see that happening. However, I didn't want just anyone breaking me down. God built me in his image, and only he has the authority to rebuild me. And I don't think anyone should ever be broken down, especially if you don't know how they were built. So now I had to get out of that program, and I had to actually call the town sheriff They sat me in a chair for 2 days while people walked past me and ridiculed me. They have things like encounter groups where people can curse at you and tell you about yourself and all of this. And it's this other thing that they have called dropping guilt. And this was what they wanted me to do, but I didn't know for the life of me what they were talking about, and I just wanted to leave. I had already did 6 months there, so that counted as my 18 months. But I had to call the police to get out of there after sitting on the chair for 2 days. They let me carry what I could carry. They dropped me off at an unfamiliar train stop. So I left my 2 bags up, went down to call my mother until I was coming home, and went back up, and my bags were gone. So I ended up going with just the clothes on my back. And so I was trying to find myself another program. And when I called into Brooklyn Treatment Court, which is the treatment court that I went through for my alternative, they said it was a warrant out for my arrest. So I just stopped what I was doing and I ran over there. And being that I wasn't in another program, they remanded me and I had to spend time on Rikers Island. So while at Rikers Island, they found a program for me, and this program was called Green Hope Services for Women. Now, this is a model that I think other similar residential treatment programs should follow. It was all women that learned how to bond with one another. And then, am I my sister's keeper? Yes, I am. We help each other through hard times. So I had the freedom in this program to explore other goals and interests, whereas in Daytop, I did not have that opportunity afforded to me. I was allowed to go to meetings at other nonprofits like Community Voices Heard, and I was even able to go to church, and I became a member of both. I found my voice. I was able to do a leadership training program called Reconnect. And from there, I just blossomed. I became an advocate, and I used my voice for other women and advocated to represent their voices when their voices couldn't be heard. So as a recovering addict, I still struggle today, living life on life terms. But if not for my support systems, this Correctional Association, New York and Women in Prison Project, and Green Hope, if not for those, I would not have had this platform to stand on. And the Correctional Association is an organization that was founded in 1844, and today they are one of the only organizations that's able to go into the prison systems in the capacity that they go in. We go in and we monitor and we shine lights in those dark corners for the things that they try to hide. And then we comprise reports on our findings. And there is no other organization that can go into prisons like that. So I think this book, Prison by Any Other Name, is another one of my greatest achievements. The message this book brings to the forefront to the still sick and suffering addicts is what we need in the rooms today. And in closing, I'm just going to say with the sincerity of all my heart, we give you Prison by Another Name. It's a must read for this year, for 2020. Pick it up and give it a read. Thank you so much, Vicki.
Thank you so much, Stacy.
You're welcome. Yeah, I had to cut it short that time because I messed up with the audio, so that was most of my time. But I hope you guys enjoyed the book.
Thank you.
Thank you.
It's good to be able to hear you. So I guess at this point, if anyone had any questions that were specifically oriented towards Stacy, since we may lose Stacy early in the evening, please do go ahead and send those to us. And we'll wait just a second here so people have a moment to get that in. If you want to ask any questions about that experience at Rikers with entrapment or any part of that. Thank you so much for sharing, Stacy.
I will be listening up until 8 o'clock. Okay.
Great. Okay, so while we wait for questions to come in, I want to go ahead and invite, let's go ahead and get Hill and Vanessa from the Steady Collective into the conversation. If y'all are available and want to come online, awesome. Welcome.
Thank you so much, Stacey. It's like an important set for us and started moving around here. Like some spotty coverage in my house.
Yeah, your
you
audio is a little choppy.
Is it? I may have to not have visuals here. Yeah, I think that at Steady Collective, I'll just say briefly what we do. We are a syringe access program, and we've been around since 2016, providing syringe access, Narcan access, fentanyl test strips, and also just sort of forwarding the principles of harm reduction, and advocating for people who are using drugs in Buncombe County. So if folks have a difficult experience at a treatment center or in the hospital, we follow up on all of those reports. And we also definitely follow up with folks who have been incarcerated or are in jail. I think one of the experiences that relates back to some of what Stacey is saying is like we have here supposedly like an alternative to jail, which is being sent to treatment. But a month ago, we had a participant get picked up for a possession charge and a resisting an officer charge. And I asked about that charge because the person seemed physically unable to resist. And they said that he had just failed to give his name. But because he had failed to give his name and he had that resisting an officer charge, his bail was set higher. And so it was difficult to get him out. And he certainly was not physically well enough to be locked up. And when I asked, is there a way to expedite his release? They said, well, he could go to treatment instead of jail. And I said, well, he might be interested in that. And what would that look like? And they said, well, let us look. Oh, actually, there's a 2 to 3 week waiting list for treatment. So it's not treatment instead of jail, it's jail and treatment is sort of what I heard out of that. And I think that's the thing we're continuously running into is you're going to end up doing both. And the treatment program you get referred into may not be an evidence-based treatment program at all. So it may be what Stacey experienced the first go around, which is just guilt and shame and very punitive. It's like being in jail. It's prison by another name for sure. And I don't know, Vanessa's on here too, if Vanessa wants to speak to some of what we read here. This book is really incredible and like really resonated with a lot of what we're seeing with the folks that we serve. And we know that folks who are using drugs, are so targeted and are spending so much time being punished for their use. And we know that many of the folks that we work with are using because they don't have access to medical care. So, they're feeling punished at every turn. They're not getting the care they receive. And instead, they're just being placed in prison or in these treatment programs that are like prison.
Thanks, Hill. I could say so much about this book. It had me thinking in so many ways about, I have a half sister who I'm 35. I've had no relationship with her whatsoever because she has been incarcerated in some form since she was 14. And so, the prison system and the alternatives to prison severed any opportunity that I had to have a sister. So I found myself, thinking about her constantly as I was reading this book. I'm also a registered nurse. And so the chapter about the sections about hospitals looking like prisons, I mean, I can speak to that for hours. I worked in an emergency department. And while I was working in the ER, they built a new psychiatric ER, and they laughed about the people coming to install the doors install the doors in prison. It's real. It's so real. But the thing I think that resonated with me the most, and the thing that I thought about the most throughout reading this book, as it relates to our participants with study, is this idea that as a society, we label neurodivergent or unusual behavior as dangerous, and we use that label to justify caging people. One of the first arguments against studies work in the community is the community coming together and saying that our participants are dangerous. They say things like they feel unsafe walking down the street where our participants are. And what's really happening is that people feel discomfort. They feel uncomfortable when they see humans operating outside of these like social norms that our society tells them. When people act outside of these norms, that they're dangerous. And then we have cops who say, if you see something, say something. It's the same thing. They're giving everyone, literally everyone in the community, permission to say, I feel uncomfortable, lock that person away somewhere. And so I think about our folks all the time, and I think about a very specific moment where I was walking outside of Firestorm, where a lot of our folks hang out because they have nowhere else to go. And I watched a couple in front of me move off the sidewalk and into the street and make shows of discomfort as they moved around this group of folks. And then as I moved through them, I got hugs. And it's just this challenging of feeling like, am I uncomfortable right now, or am I truly in danger? And how do we convince folks that discomfort and danger are two different things?
Yeah, I think that is like a thing that we continue to run into, because we are also feeling like our program makes people very uncomfortable. And so a question that we get a lot is what we're doing legal? And in the state of North Carolina, syringe access is legal, and it's been legal since 2016. But that is a common question. Like, should we also be locking up the staff of Study Collective for the work that we're doing? And I think a question that came up for me while I was reading the book was, is it true, or does it just feel true, that we're actually incarcerating people for asking for help? This notion of surplus people, or people who need other services, just being incarcerated. Are we actually imprisoning them for asking for help? Because it often feels that way when people reach out to a doctor, they go to receive medical care, and then that doctor acts basically as the police and reports them. Are they reporting them for asking for help? And it does feel that way. And I think our participants feel that way, and then become even more disengaged from the services they need because they're afraid of being incarcerated.
Yeah, I think that's absolutely like one of the core pieces that we've seen is people being locked up in various ways, whether it be in prison or in the community, for either asking for help or not asking for help. Right? It's a lose-lose situation. And one of the reasons I came to this kind of writing is because my sister was incarcerated and in treatment, on monitoring, on all of these different things for 15 years, starting over 15 years ago. And she was addicted to heroin and would hide from the police instead of calling the police when she needed, or not calling the police, calling 911 when she was in a health emergency. She would say, I'm not gonna call 911. Like, I would rather die than go back to jail. And she actually did die in February. And she was in a drug court program at the time. She was in a mandated treatment program. She was getting help, being coerced into getting help. And she was in a program which is almost all drug court programs, so like virtually all drug court programs, which was completely abstinence based. And so she was being forced not to use. And therefore her tolerance went way, way down. And so when she overdosed, she died. And I have so much rage toward this system. This all happened after we turned our book in. So it's, you know, not mentioned in our book or anything, but I have so much rage. And a lot of this is things that we discussed in our book around the fact that this whole system of coercion that she was mired in for 15 years was constantly presented as help. It was constantly presented as, well, this is what you need. And some of that was punishment-based help, like Stacy was talking about, where they would say, well, you really need to hit rock bottom. Like the worst thing ever needs to happen to you in order for you to turn things around. And I think that when you're put in a place where that's what help is, why would you ask for help? Because that's what help is. Help is jail. Help is being locked up somewhere else. Help is going through withdrawal, unmedicated, like torture, you know? And so I think that these are some of the frameworks that we really have to challenge and change. One of the people we interviewed for our book was Ruth Wilson Gilmore, the abolitionist scholar and organizer, and she says abolition is deliberately everythingist. It's her thing. It's everything. It's about all of human environment relations. So how we relate to each other and how we respond to different ways of experiencing the world and different behaviors, we have to think about that as part of our abolitionist work. So confronting ableism is abolition work. Confronting ableism and its linkages with white supremacy and anti-Blackness and patriarchy and heteropatriarchy is abolitionist work. And the last thing I'll say on this is, I think that sometimes, even when people are uncomfortable with criminalizing people, they're sometimes fine with medicalizing people or I guess coercively diagnosing people. And that's something that we need to pick apart. Speaking of hospitals, emergency rooms, people are regularly involuntarily confined on the basis of a mental health diagnosis. And now in 37 states, I think it's legal to involuntarily confine someone because of either a substance abuse disorder or alcoholism or both. And so just as people are involuntarily confined for convictions in the criminal legal system, there are all these other involuntary confinements happening that a lot of folks don't see as a problem because they result from diagnoses as opposed to convictions.
Thanks, Maya. Stacy, if you have time, I know you have to go soon. There is a question from the YouTube channel. So it says, Stacy, thank you for telling your story. From your experience, what advice or just what would you tell someone working in one of these drug treatment programs thinking that they're doing good for people?
One of the things that I was telling, and I just typed up the answer to that question, was they still need to think about us as human beings. They need to treat us with a little more humanity and sort of help us to learn how to live life on right terms, which means allowing us to do things that we never done before. I never thought I would become an advocate, but with the platform and the support that I had, I was able to find that out. So give them a little more supportive things to help them as they get good treatment.
Thank you. Before you go, do you have anything else you wanted to share with viewers and listeners?
It's a big step. I think we all need to, in involve other entities of the community. You need to involve your police, involve your legislators, involve the community in helping these people that are having alternatives, those that are stuck in prison. I mean, we monitor the prisons a lot, and it takes a lot of change. We had to do a lot of things, and a lot of advocating, a lot of rallying and protesting in order to get some of those things changed. But we have to just make it seem like a human need instead of just money, because some of it is not just so cities can get that money, but we need to think about it in a humanity type of way.
Thank you.
Thank you so much, Stacy.
You're welcome. Thank you. And I'm going to sign out now, and you guys take care and continue to spread the word of the need.
Thank you, Stacy. Thanks so much for taking the time to join us and making this possible. Have a great rest of the night.
Thank you so much, Stacy. Have a good night.
Thank you so much. Bye-bye.
Great, and so I want to use this as a transition moment to also bring Julie from Blue Ridge Anarchist Black Cross into the conversation. Julie, if you want to step in and share any reflections or thoughts you had reading this book. I know that you also really enjoyed it.
Yes, I really did. Yeah, I guess I'll just quickly mention a little bit about Blue Ridge ABC. Also, thank you so much to Firestorm for facilitating this event, and Steady for being here, and of course to the both of you for writing such an excellent book that's been such an important just contribution to the conversation. So Blue Ridge Anarchist Black Cross formed in 2016, kind of in response to the historic nationwide prison strike. And I just mentioned that event as kind of the genesis of our group because it was such an important event in terms of the resistance that we see to the carceral system by people who are most affected by people who are living it. And obviously it's the same system that Victoria and I are writing about, even though they're writing about, kind of the other side of the bars. But it morphed out of the inside of the bars. And seeing the thousands of people in prison who mobilized for their own kind of liberation through work stoppage showed us that locally we needed to be doing more to support incarcerated people and amplify their voices, especially those who we are politically aligned with who are incarcerated for engaging in political dissent or had become politicized while in prison. And so we formed as a group kind of in response to that and started doing political prisoner letter writing nights, hosting film screenings, and just trying to get the conversation going locally. And we also noted a through line between the people that we were corresponding with in prison and then the repression that was happening on the ground and continues to happen for kind of targeted and criminalized political identities, especially anarchists. And so we felt it was important to kind of create on the ground anti-repression infrastructure in the form of a bail fund and doing jail support. So that's something that we've been doing since 2016 and which with the current uprising since the murder of George Floyd has really, really grown. And I think that, I think the tie-in to Prison by Any Other Name is really in the recognition that the book, which talks about these so-called, alternatives to incarceration, are happening in this context where it's so clear that the state is trying to solve a problem that it created of creating a bunch of people who are considered surplus, which I think is stated in the book, and who don't have access to really just the rudiments of a dignified existence in our society. And the state is trying to solve that problem with prison and has been for many decades. And then to see that kind of morph into the system now where it's like, okay, that's not working anymore. Now let's figure out a different way that we can continue to control this kind of group of people who are seen as surplus, but pretty it up and make it seem more acceptable. I think that really connects with Blue Ridge ABC's work, because the people who we're primarily corresponding with and supporting behind the walls are people who have spoken out against that system of kind of structural and systematic disinvestment from people in communities. So, you know, a lot of like Black Panther Party and Black liberation struggle prisoners from the 70s, even on through to today. And yeah, so I think that was a big tie-in for me, of just seeing that the system that has incarcerated the people that we're kind of like supporting for trying to actually provide a real alternative, which would be like a revolutionary alternative, are then criminalized and put into the system. So I think for me that was a big tie-in, and I was really happy to see this book come out, because, and I saw that Michelle Alexander wrote the foreword, and I was glad to see that too, because my biggest kind of takeaway from reading The New Jim Crow was like, okay, so the point is that in every age we see kind of the forces of racist dehumanization like recoalesce into something new, and so we need to be just extremely vigilant about looking for the moment when that trajectory seems to like be restarting anew. And I think that what Victoria and Maya have just done so incredibly in this book is point to exactly that. They're like that's what's happening right now, is the system is renewing those forces in a different face, although not completely a different face, because it's still incredibly racist. So yeah, I think that was a really important takeaway for me, of just this book tracking that phenomenon and helping us to put our finger on it very clearly in our current moment, and hopefully, you know, showing the way so that we can intervene and prevent some of those things from playing out as far as, unfortunately, the mass incarceration system has over the last 30 years.
Thanks, Julie. Great. So I want to go ahead and pull in a question from our Q&A. Tanya has written in to share and ask some questions. Tanya says that they are writing in with James, who's currently incarcerated as a juvenile lifer, and they would both like to know, what is the avenue to actualizing the kind of dramatic system changes that are needed? And then also, what does it take to change the narrative? And I think maybe that narrative piece came in when we were talking about the way in which people are labeled as dangerous. And that's something that I feel like I would love to hear from any of the panelists on these really challenging questions around systemic change and narrative shifting.
Well, I'll start and then Maya can jump in. So when we're thinking about, like, how do we actualize these changes? It's not going to be an overnight process. We did not come to this system of mass incarceration, mass probation, mass surveillance, and coercive control overnight. It took decades and centuries to get to this point of building on white supremacy, genocide, misogyny, patriarchy, transphobia, et cetera, et cetera, et cetera. And so we're not going to tear this down overnight and rebuild something new. What we can do is work every day towards these goals. So how do we actualize this in our personal lives, and how do we actualize this in our political lives? How can we advocate for dismantling the systems that keep your child in prison as a juvenile lifer? And then how do we also advocate for maybe not formalized, maybe formalized systems, maybe informal systems that keep people safe and meet people's needs? So I don't know the specifics of your child's circumstances or what happened that landed them in prison as a juvenile lifer. But if we think about, say, Stacy's experience, I know it's maybe apples and oranges, but what did she need and what did she get? She needed to get to her mother's house and not be entrapped by a police officer. What did she get? She was told that she could go to drug treatment or she could go to jail. So she was coerced into treatment, and then in treatment, this coercion continued. So she was told that she had to do things. As I talked earlier about mental health confinement, she lost all bodily autonomy. She was told when she could get up, when she could go to sleep, that she had to go to this treatment group, that if she did this thing that was bad or deemed bad, she had to sit in a chair in the hallway as if she was a 2-year-old in a perpetual timeout, while people were walking past her, all looking at her, sitting on a chair. Now, none of this seems to be the type of treatment that would enable somebody to address why they had a substance use disorder. It definitely did not address why Stacy, as a Black woman living in New York City, was followed by an undercover cop who just harassed her and harassed her and harassed her until she gave in and bought drugs for him so that he would stop following her to her mother's house. So I think that one of the things when we talk about actualizing this is we need to look, kind of pull it apart and look at all these pieces. Are there, roles that you can play in advocating that entrapment laws be changed, or prosecutors no longer be able to use these types of entrapments in their prosecutions? Are there laws that can be changed that throw away this idea that people are disposable and should become juvenile lifers? And then on the flip side, what can we do to shift the narrative and shift our priorities so that we're not relying on policing in prisons to keep order or keep law and order, and instead actually meet people's needs? Like, what if Stacy had said, hey, I need help because I feel like I have my substance use has become substance abuse and it is negatively impacting my life. And she was able to go to a place where she could maybe do outpatient treatment or inpatient treatment, where she was treated like a human being, where people talked to her about what the underlying factors were that caused her to begin using and then depending heavily on substances. And she was not penalized if she relapsed or broke rules, and instead had people who cared and treated her as if they cared. And we know these places exist because they exist for people with a lot of money, usually wealthy white people like Betty Ford. So we know that there are these places that exist and help people overcome addictions that are negatively impacting their lives, but they don't evenly apply to everybody. And instead, what we get is a sort of prison light for people who are seeking help. Maya, do you want to jump in?
Oh no, I thought that was great. Like, I can answer the next question. I thought
Okay.
that was beautiful.
Well, maybe I'll jump in with a question, which actually partially by way of
answering the previous one. I think one of the ways that we change the narrative is when we have opportunities to weigh in on something, to not kind of go for that low hanging fruit of just saying, let's get people out of prison, but really pushing the envelope and making the argument that Victoria and Maya make in the book of humanizing people, and the idea that it's not okay to, like, not being in prison is not good enough. People should have access to the breadth of life and autonomy that we all have, or that we probably want more of. And so one of the questions actually that I was hoping to hear from either of you or both of you on is whether you've heard about successful or current campaigns against companies that are doing electronic monitoring, and if you have any advice for folks who are wanting to organize in their own communities against electronic monitoring, like where should should folks begin? And if you want to also speak to some of the specifics that you lay out in the book of, just how predatory those companies are and the way the costs get passed on to people.
Sure. Yeah, so I can start with the costs and how that impacts people. Basically, electronic monitoring is put forth as a cost-saving measure for people, for communities, municipalities, and states, because people are not behind bars, so there's no mandate to feed them, house them, all of the other things that prison purportedly is obligated to do, provide health care, even though obviously in prison this is terrible health care, it's an obligation. Prison is very expensive. So electronic monitoring is a favorite of many conservatives because it's supposed to save money. And another way in which it's kind of a banner reform for conservatives is that people are actually charged for being confined on electronic monitoring. So this can be anywhere from $5 to $40 a day that people are paying. And keep in mind that people on electronic monitoring are disproportionately low income and also are going to have a harder time finding jobs and other sources of income because they're on the monitor. And that's such a restrictive position to be in, and it biases employers against them. And so people are being charged, and they're being charged actually regardless of whether it's a public monitoring situation or whether they're paying a private company. Now, private companies are definitely profiteering off of electronic monitoring. In fact, many of the same companies that operate private prisons are now in the electronic monitoring business. But we do want to be clear that it's not these companies who are causing electronic monitoring to happen. They're simply cashing in. And so when we think about what could be the recommendations, like what are concrete steps people can take to organize against electronic monitoring or against the type of things that we're talking about in our book regarding monitoring, it's less about targeting the companies. And of course, that's always a strategy. But one of the things that we notice sometimes with campaigns that target private prisons, for example, is that they inadvertently then legitimize public prisons, unless you're really, really careful. And of course, we don't want people in any kinds of prisons. And one resource that I would definitely encourage people to look at is the website challengingincarceration.org. That's James Kilgore's website, and he's an organizer who's really been blazing the way on this issue of electronic monitoring. He was on electronic monitoring himself and then began organizing specifically against this through an abolitionist frame. And he and some other organizers put together these guidelines, a set of guidelines for respecting the rights of people who are on electronic monitoring. So kind of guidelines for people who are already on a monitor, how people should have human rights even in that situation, obviously. So that's a good one to look at. There have also been some bills here in Illinois because James Kilgore lives here, and so there are bills that have happened here that haven't necessarily happened anywhere else. And some of them are requiring transparency from the Department of Corrections about their electronic monitoring programs. So this is the first step. There is barely any data on electronic monitoring. So every year the numbers of people in prison come out, like we get data on that and it's horrifying, but we know those numbers. With electronic monitoring, much of it is hidden. So that 200,000 number, that's an estimate. It could be much, much higher than that. So activists are working to compile data from city sources, state sources. And so that data bill did pass. And now they're working on other bills that are kind of going to be more action oriented, like banning electronic monitoring for people coming out of prison, except for people who are mandated to be on it by some other piece of legislation. So that would be huge, because right now, a lot of people on monitoring are actually under some other form of coercive control as well. They're on parole or probation. And so people coming out of prison who are on parole, this bill is going to say those people should not be on electronic monitoring. So this is one of the things that we try to do in decarceration in general, is shrink the system, shrink the number of people who are under these these control mechanisms, while at the same time we're building up all kinds of other systems that we want to see existing. And then there are some other kind of harm reduction electronic monitoring legislative measures, like one that is being proposed to ban user fees altogether. So just ban that practice of requiring people to pay. And I think that actually might be a more effective route than targeting specific companies, because it's saying no one should have to pay for their confinement anywhere, regardless of if it's a private company, if it's public, no matter who is operating it. It should not be something that the person who is impacted is paying for.
Thank you.
So we've got a question submitted from an attendee, Davidson, who is asking kind of back to the question of substance use and criminalization. Davidson asks, is it simplistic to look at the supply chain wherein drugs are manufactured and track them to ensure proper humane distribution? And I think maybe this question also gets at another like trend in, I think kind of a more radical minded reform with safer injection sites. Are there ways in which safer injection sites either kind of like break out of this kind of paradigm of surveillance and control, or conversely, are there ways in which those safer injection sites could be weaponized against individuals who use drugs in much the same way we've talked about some of these other alternatives? And that may be a question both for authors, but also I imagine folks from STEADY might have some ideas about that too.
I'm happy to speak to the safe injection piece a little bit and sort of what's happened with the world of harm reduction. So harm reduction within the US is, been around since the 80s. And when it first started, it was a group of folks who, were closely affiliated with groups like ACT UP. So it was activists saying, we're not really invested in people's recovery if that's not something that they want. We want people to be safe and to not be sick. And so we're going to make sure that they get sterile injecting supplies. And what's happened over time is that syringe exchange has been legalized across the country. And anytime legalization happens, we start to have involvement with the state and the state regulating how harm reduction programs can work. So Buncombe County is a pretty good example, because we now have a syringe exchange in the Buncombe County Health Department. And that syringe exchange is guarded by sheriff's deputies, by 2 law enforcement officers. And you have to give more information than you typically would at an exchange like Steady Collective that's community-based. So my fear is that if safe consumption sites are legalized, that we will get sort of the same kind of state involvement where they will regulate how they look and how they go, and they'll get some say in their involvement, in the state's involvement in those spaces. So I think safe consumption sites can be great. Obviously, they save a lot of lives. They prevent overdose, and they have nurses on site, and that's wonderful. But I think when we push for something, as Julie sort of noted earlier, we need to not just go for the low-hanging fruit. We need to be really explicit about what we're asking for, that we want safe consumption sites that are run by community-based groups that don't have state involvement and that won't involve the police.
Yeah, I would just echo. I think that was a really good answer, and it's something that we can ask ourselves whenever we're putting forth an alternative, because I think there's a lot of hope to me in the prospect of safer injection sites, and it is a question of, like, how do you actually take the police out of the equation? So not collaborating with the police, not doing some sort of community police public health partnership, but saying this is actually a police-free space. And I think there are some hopeful examples of that going on right now in the movement to defund police, particularly the movement for police-free schools. So I think there's a precedent that we can be drawing upon to ask for police-free spaces in all kinds of different contexts. And I think especially when we're talking about these really hopeful harm reduction possibilities, that's another opportunity to say, look at this. This is something that needs to be a police-free space.
Thank you. Those were great answers. So we don't have a question queue right now. And if anybody wants to step in and ask a final question, it looks like we are down to our last 10 minutes or so for the event. It's been an incredible conversation. I really appreciate all y'all for being here. So if anybody wants to chime in with a question as a participant, or if any of the panelists want to share additional reflections, please go for it.
It looks like there was a question that ended up in the answered box, but could be one that folks would find interesting to discuss. I can read it out. I really appreciate the discussion of psych hospitals paralleling prisons. Love the work that Steady does supporting our community members that use drugs. How can we make headway in promoting humanizing initiatives at the state and federal levels?
Well, I think part of it is organizing. Early in our book, we interviewed Ruth Wilson Gilmore, who was actually on a panel Thursday night, one of the nights this week, with Mariam Kaba, and she talked about organize with people who are already organized. So you don't need to reinvent the wheel. You can say, you could see what is happening with people who are organizing around drug use, decriminalization, humanizing the narrative around drug use. You can also organize with people who are organizing around the rights of people with mental illnesses and mental health issues. We interviewed people from, one of the people that we interviewed found the Icarus Project, which is now called the Fireweed Collective. And they are a support system, a support network for people who have mental health issues. And they don't have a proscriptive agenda. They don't say like, don't take medications or do take medications. And instead they say like, what do you need? And then from there, people can see what is happening on their local level or on their state levels and get involved that way. Because me being in New York City and Maya being in Chicago, we might have two very different landscapes around what organizing might look like, what our community's needs are, what needs to happen, what laws are already in place that need to be overturned, what laws are in place that perhaps nobody knows about because they're never used. So I think part of it is that people should get involved with other folks. So organizing is not just I sit in my house, Maya sits in her house, Stacy sits, in her house, and we all just try to do all of this by ourselves, but see what's happening on the local level in your communities, who's already doing the work, and ways in which you can plug in, whether it's, hey, I work with this organization, maybe we can partner on some of these initiatives and we can figure out how to support each other so that we're not all stretched super thin, but also figuring out where the intersections are between all of these interconnecting issues. And earlier, it was either Julie or Hill also talked about the idea that sometimes there's discomfort with the way that people are acting, which is different than an actual danger that people present. And, talking and educating where you are, that there's a difference between being uncomfortable with somebody's behavior and feeling like you are in danger. So I live in New York City. I live in an apartment building. I've always lived in apartment buildings throughout my adult life, which means you have lots of neighbors and you hear lots of neighbors. Some of the neighbors I have had mental health concerns. They are not dangerous, but sometimes it might be a little irritating or annoying to be like, oh, this person is perhaps having a mental health issue. It is not a crisis, but it is something that they do. Like they yell very loudly at all hours. That is annoying. It is uncomfortable. But it is not dangerous to me. And there's a difference between dangerous, this might threaten somebody else or they're a threat to themselves, and this is what happens. This person is aware of this. They also are seeking treatment or not seeking treatment or whatever they are doing. And it is not my business to go try to impose my notion of what needs to happen. Like, be quiet, don't have these, don't yell at midnight. Don't X, Y, or Z. Because so again, the difference between discomfort, somebody is talking to themselves, or, and danger. Somebody has a gun and is threatening to shoot everybody. Like there's a very, very, there's a very, very big gap between that. And I think that one of the things that relying on policing and prisons and a very Stepford Wives type of normalization is that we're trained to see something that we find uncomfortable or we have discomfort with and say that it is dangerous, rather than we see something and we say, this person seems to maybe be having a bad day and is talking to people and is yelling at people who aren't there. I'm just going to cross the street and continue to the laundromat. But it is not necessarily I pick up the phone and call 911 and involve a whole host of other dangerous elements into the situation.
Yeah, I think that speaks to, one of the most profound and also challenging things about your book is that one of the things I really took away from the book is that one of the problems with talking about alternatives to incarceration or policing is that often there shouldn't be an alternative, right? Often, the reality is that the alternative is that we should not respond. And I think that's hard. I think that's a tough thing for people to internalize when their expectations living in our society is that, I believe Vanessa said earlier, if you see something, say something, right? If something is dangerous looking, or even if someone appears to be in danger themselves, that somehow calling on some sort of state response or coercive response is necessary, when in fact the reality is that may itself cause greater harm than the thing that you're witnessing that's prompting. And that was a real takeaway for me from the book that I think a lot of people will struggle with, but also if they read the book, I think be challenged to kind of like integrate into their own approach to conflict and navigating the world. So we are down to the last few minutes, and it looks like we've got maybe one final question that we'll throw out there before we wrap up here. Writing in, someone asked, do you have a suggestion for what system would be best to support a close loved one who seems to not be able to make sound judgment for themselves, i.e. has a substance abuse disorder, who's a danger to themselves and others, and has mental health issues that could be hindering their judgment? Is there an alternative to having is there an alternative to the current flawed systems that would step in?
Yeah. So can people hear me? I just heard my headset make a sad sound. Okay, great. Yeah, I mean, I think the alternatives, unfortunately, have to still continue to be developed. We're so in this position right now of prison being ingrained in our minds, the police being ingrained in our minds, that sometimes it's hard to think outside of that. And also beyond the personal, there's very little infrastructure in place in our society for supporting people with addiction and with mental health problems or diagnoses outside of these state systems. And so part of it is those things need to change, right? There needs to be a culture that is very, very different in terms of offering many, many different harm reduction mechanisms and also support systems for people who have a substance abuse or a mental health issue. And I mean, I'll say for myself, years and years after I started identifying as an abolitionist, there were still moments that I wanted my sister to be in jail because I thought, okay, there's less of a chance that she'll be using heroin in there. That was my, like, just my approach, even as someone who who was like publicly abolitionist, because it's so hard. There's so little support out there. And the thing, obviously, I'm not the best person to ask about how to have a like super successful interaction on that front. But what I will say is the thing that I did that I found the most helpful, and the thing that I'm trying to do with people I'm currently supporting around substance use, is establish an open channel of communication, know the resources in your community that you're able to connect people with, because sometimes there are resources out there, they're just like very hard to access. And be available in a way that allows you to still have personal boundaries. So one thing that I started doing toward the end of my sister's life that I think was helpful for both of us was just listening, because I had spent so many years trying to offer solutions, trying to say, okay, as long as she gets into this treatment, you know, instead of going to jail, instead, as long as she's sentenced to this diversion program, then there will be a chance. Or if I convince her to go to detox, there will be a chance. And then eventually realize it was not me. Like, I was not the person who was able to determine the future in that particular situation, especially with so much court and criminalization involvement. And so, yeah, I mean, there's no perfect solution, but listening, channel of communication, finding and offering the resources, and providing that information regularly And then also organizing, if the resources aren't there, reaching out to people whose loved ones are in similar situations or who are in similar situations themselves, and working on how can we build that, and that's something that I'm hoping to continue doing as well, because we need to build that society where there are those support systems. That's, I think, the thing giving me hope right now is that there's so many people who want to do that. you know that's kind of what I'm trying to keep in mind, is like, even if that stuff is not there, we have people, and we'll have more people once, I think, once more people who are impacted by these issues and more people who are interested in the movements that are rising up right now and don't realize the connections to all these other systems. Once those people become more activated, I think there's so much potential right now, so a little bit of hope on my part.
That's great. I'm glad that we're ending on a hopeful note. And my favorite part of the book was the last chapter, which is the hopeful chapter. So please, everybody, make sure to read the last chapter. Thank you to all the panelists and to all the attendees. Super big thanks again to our incredible ASL interpreters and the captioner. Y'all have just done an awesome job, and it's been such an honor to be able to be here with you tonight. I wish you all well, and I hope that if you have not already, please pick up a copy of the book. Thank you again, Maya and Victoria.
Thank you.
Thank you so much for hosting this conversation.
Yeah, thank you. And yay, Firestorm.
Yes.
What a wonderful storm. Yeah.
Maybe sometime we can even do this event in person.
Yeah. Someday.